I am very pleased to introduce our keynote speaker today. Welcome Jonathan Fleece and the New Health Age.
Healthcare in the 20th century was a model built around sickness. In the 21st century, as part of the New Health Age, the whole thinking model is changing. We're moving towards thinking about healthcare as wellness. In the 20th century, they got paid for procedures. The more admissions, the more patients, the more procedures, that's what drove the revenue model in the 20th century. In the New Health Age, we're moving towards and are in a model based on performance. We have not only the ability, but we have the responsibility to help make the New Health Age a true global transformation. And over the last 5 years, as we've been working again with audiences, boardrooms, companies, policymakers across the country, we've heard over and over again that if you're not having a conversation related to the future of healthcare around these dynamic flows, you're not having an educated conversation. The future is here in the New Health Age. It is just not evenly distributed.
Jonathan Fleece has been a friend for quite a while. He's definitely one of the thought leaders when it comes to the new healthcare age and some of the changes that are going to be coming from the ACA. And I think he really speaks well to both business owners as well as to patients as well as to physicians, and pretty much really deals with all of the different stakeholders within the healthcare community.
Absenteeism is going down, worker productivity is going up, and companies are becoming more successful because of engaged and healthy workforces. We predict in the New Health Age that a day will come that Wall Street not only measures companies and stock prices based on their earnings, but also measures company and stock prices based on the health and fitness of their workforce. Why this slower pace of change in healthcare than David and I expected over these last 5 years as we've traveled the world talking about the New Health Age? It boils down to this: lack of leadership. Lack of leadership amongst policymakers, lack of leadership amongst the business sector, and lack of leadership in our communities. But guess what? We, the leaders in this community and this nation, have the power to change that. We are the leaders. And it's time to stop casting blame. So where should leaders take us? We, the leadership of our communities, into the New Health Age. I propose a new comprehensive definition of health is what it will take to move us truly into the New Health Age and continue this movement towards a global transformation in health and healthcare. To be a healthy being is a healthy mind, body, and soul. And what are you doing with that being? Are we elevating our beings to this place of a healthy mind, body, and soul, or are we not? Because I think if we redefine the definition of health around mind, body, soul, being, that is what will create the spark. That is what will create the inspiration. What is next for me? What is next for you is a new narrative. A new narrative around the New Health Age. And that new narrative is to be for health. Thank you so much for joining the movement to be for health as the New Health Age becomes a global transformation in the 21st century. Thank you very much.